Okay, cool. We're being recorded. All right, so my name is Chisna. I am a senior at the moment, and I'll be graduating in the spring. I am a pre-PA, oh Lord, I am in the pre-PA track and a biology major, as well as a chemistry minor. I'm the pre-PA chair of the pre-health liaison of Simmons, and I use she, her, hers pronouns. So I'll pass on to our panel. Erica, Kirsten, and Alexis are on our panel tonight, and just names, pronouns, and if you're a current PA student or a current PA.
Okay, I can start since you said me first. I'm Erica Morelli. Pronouns are she, her. I'm a current PA. I work at Dana-Farber Cancer Institute. I've been there for 7 years.
I guess I'll go next. Hi guys, I'm Alexis. I am a general surgery PA at Brockton Hospital. I just graduated PA school last year, so I've only been there for about a year. And my pronouns are she, her, hers.
Good evening, everybody. My name is Kirsten. I'm a current PA student at Northeastern, and my pronouns are she and her.
All right, thank you. So we'll go right on and start our Q&A session, and at the end of it, we'll have a little bit of time, and anyone can ask any questions they have. Really, now's the time to do it. So starting with the first question. All right, what influenced you to become a physician assistant? Anyone can start, or we can keep the same order that we already started with.
Okay, I can start. That's a tough one for me to answer because it took me a long time to even know what a PA was. It's much more popular now, I think, but when I was in an undergrad, I had no idea what it was. There was no PA program. There was no pre-PA program. I didn't learn until after I graduated from college, actually, what a PA was. So I had a similar, I was on a medical track, but I was going to go into research or bench work, like lab work. And then after I graduated, I met a PA while I was doing research. And that's how I even found out that it was a profession and what it was. So that's kind of what got me into the PA program or the PA profession in general. I always wanted to go into medicine for many different reasons, mostly personal with family experience with parents who had cancer. And that kind of triggered my interest in the field in general. And then I kind of realized that it would be, once I realized what a PA was, I thought it would be a really great sounding profession. And that's I kind of fell into it that way, I think.
Nice, thank you.
Yeah, my experience is actually very similar to what Erica was talking about. I really didn't know much about the profession. I wasn't really well aware of it. And I actually was pre-med for most of undergrad and was planning to go to medical school. And part of that was doing internships at the hospital on campus. Where I ended up working with a lot of PAs. So GW, I don't know if some of you are applying, but they have a pretty large PA program. And that's where I went to undergrad. And the hospital had a ton of PAs in their ER. And that's where I was really interning at. And I really saw the role of the PA in that team, and I just loved it. They spend the most time with patients. They got to do a lot of patient education and a lot of history taking, and they really got to do the diagnosis themselves. And that's what I wanted to do. And they left their work at work. And when they went home, they had a life. And that, again, is really what I wanted. And that's what really inspired me to go to PA school. And even now, I have no regrets. So.
I'd say my interest in, or my influence came kind of twofold. I used to be a track and field athlete. So I used to, we go through our fair share of like injuries and mental blocks and things like that. So I always had like a good, team around me in terms of like my coaches or sports psychologists, things like that. So, and also I would help out my teammates when they would have like obstacles that they would go through to achieve their goals. So I always knew that I wanted to assist others, just didn't know like in what way. And I found out about the PA profession towards the end of my undergraduate career through like a webinar, sort of like this. But it wasn't until like my direct patient care that I really experienced what PAs were, and again saw their role in the healthcare profession. The PA that I worked alongside with at a women's health clinic in DC, she not only did her work at the office, but also owned a child birth and education class, and also did work abroad in Ecuador, which she allowed me to go with her as well. So she was kind of limitless in my eyes. So it was nice to actually see like how much work she was doing with her degree.
Nice, thank you. And kind of going off of that, I know there are times where things get overwhelming, and you just start to question everything. Did you guys experience that moment where you weren't always certain that this is what you wanted?
Yeah, for sure. I think luck was in my favor a little bit, that I was interested in medicine from the beginning. So I knew I wanted to do some aspect of medicine or medical practice or research. So I had a lot of the prerequisites that I needed by the time I graduated from undergrad. But it was still quite different. I majored in molecular genetics, so I was like very research focused and wanted to do lab work, and was really trying to get on that track. I had a research job once I graduated from undergrad, and I started doing that, and I started actually working with patients, not just doing lab work. And I was like, oh, okay, this is really interesting. Maybe I actually don't want to do lab work. I really like lab work, not to knock lab work. It's amazing, and people need to do it, and I miss it in a way. But I was like, I really like talking to people and seeing people, and I thought I would be better at taking care of patients than doing bench work. So I kind of grappled with that for a while. And after I graduated from undergrad, I actually was off for 3 years, kind of trying to figure out what exactly I wanted to do. And during that time is when I met the PA who introduced me to the profession. So I kind of am so appreciative now, looking back on it, like all those years ago, that I kind of had that period of time where I felt a little bit lost and wasn't quite sure what I wanted, to be able to find something that now I totally love and don't regret for a single second. And if I didn't do this, I probably would have gone into bench work, and I probably wouldn't have been happy. So I'm really grateful for that. But certainly, like, went through that period of feeling like I don't know what I want to do.
I'm sorry, COVID times, and someone else is actually on a call. Can you repeat that question for me?
Yeah, sure. I was talking about how we can all get overwhelmed sometimes and just don't know if we really want to do what we're going into. So did you ever feel like, is this really what I want to go do with my life, like forever?
Yeah. So it took me a long time in my undergrad to figure out this is really what I wanted to do. I always knew I was interested in medicine. It was definitely the subject I was most interested in. And then after doing my rotations, or my undergrad rotations that I did for a class, I just loved the patient care aspect and being with people and hearing their story and learning what I could do to help them make a difference. And that kind of inspired me to really want to do medicine. And now as I look back on it, I work with a lot of residents in my job, and their road is so long that they have to take to become a PA or to become a doctor. And I am thankful every single day that, I'm not on that path. Also, I love what I do. I love everything about it. My job gives me a lot of autonomy. So I operate at the full extent of my license, and I really appreciate that. And I love that when I leave my job, I leave all my work there and I go home and I live a life. And that is really what I want to do. So at this point, I have no regrets that I made this career path choice. But it definitely was a long road to decide that this is what I wanted to do, for sure.
Even though I'm not practicing yet, still in my second year, nearly done though. I don't regret the decision to make the leap to go to PA school. I was originally going to become a physical therapist, but again, after direct patient care hours, and again, I love PTs. I love the work that they do. They can do a lot, but I wanted to be involved in like a different aspect of patient care after working there as a PTA for some time. So yeah, I don't regret all the hours I put in and things that really helped me and motivated me to make the leap to go to PA school. So I don't regret the decision at all.
Kirsten, wait till you start working. It's way better than PA school.
Thank you. Very, very thankful for that.
All right, thank you. Our next question is, what challenges did you face during undergrad and PA school?
A lot is the short answer. I mean, as we all do, right? Like undergrad is tough for so many different reasons. Like we're trying to figure out who we are as a human being. We're meeting new people. I left, my home and like many of us do, we went away to college, and just kind of figuring out your life like was really kind of tough. But coming into, who you are and what you want to do, like that is huge. And it took a long time. I think we're all kind of appreciating that there's no linear path really to get there. There's a lot of ups and downs. I ended up having a really great undergrad experience, and I loved where I went. I went to UVM in Vermont, and it's still a place that I go back to frequently, and it's still a city that I love. But, there certainly were a lot of challenges. I mean, I did really well in high school, and then you get to college and you're like, okay, this is a lot harder. And the classes I was taking were really challenging, and I struggled with like, can I do this? And am I going to get good enough grades to be able to do this? So that was always a challenge. And then when I made the decision to go and become a PA, I had to take a couple classes because I had a different major. So I still needed to take a couple of courses. And then I was working full time and, just trying to support myself and be financially independent. And as a lot of us are doing, right? So that was a challenge for sure. When I think back on the time, it feels like it was a long time ago, but I can certainly remember, just trying to figure out life and get through each day working and not making a lot of money, but trying to just see where things were going to go. Again, like looking back on it now, and I love doing these panels because it really makes me kind of reflect on everything. I'm so grateful that like there were those struggles and that I got through it and went to PA school and now work as a PA, because it's an amazing, amazing profession that has a ton of possibilities and opportunities and potential. So all of the struggles of like, just getting through the difficulty of taking the courses and getting your work done and paying for school, like the financial burden is pretty high. I still am paying loans, 7 years later, and for several more years. So there's a lot to think about, but the rewards greatly outweigh the difficulties for sure.
What I would say is kind of almost exactly the same as what Erica just said. And I was the top of my class in high school, and then I got to college, and everyone is really great at school as well. And it's a different environment. And I definitely breezed through high school, and starting in college, I had to learn how to study, like really study. And so freshman year was kind of a challenge from that aspect. I also struggled with figuring out what I really wanted to do for a long time, because both my parents are miserable in their jobs, and I didn't want to be like that as well. So I spent a long time trying to figure out what I was passionate about. And ever since my senior year is when I decided to go to PA school. And luckily I took all the classes I needed to, because, there are very specific courses you need to take to even apply to certain schools. So I didn't have to do any extra classes after college. So I was really grateful for that. But, ever since then, I just loved my choice. PA school is an incredible challenge. Anyone who went to PA school will probably tell you the same thing. It is not easy. It is medical school compacted into 2 years. And it's many tests back to back to back to back. And my struggle of undergrad, learning how to study, knowing what, to spend time on versus what to move past, really helped me in PA school because I had to further refine those skills. And there were a lot of times in PA school where I was just like, I don't know why I'm doing this. I could have done something, like I could have worked in a lab and life would have probably been better. And as Erica said, I have so many rewards. I'm so thankful every day that I ended up down this path. So it's totally worth it, but PA school is a struggle. Luckily, it's only 2 years for most places, sometimes 3, but it's definitely worth it.
Yeah, I'd say my experience is pretty similar. I was a student athlete again in undergrad, so my biggest challenge was just trying to devote my time to other things other than athletics, which was a full-time job for me. And it took up the majority of my day. So the back half of my day was just spent towards, studying what I needed to for my courses and things like that. So, I needed to finish up some classes once I got done with undergrad, once I figured out PA school was the thing that I wanted to do, or maybe what I wanted to do. And also getting volunteer work, because I couldn't do that really with athletics. Doesn't mean that it can't be done, because I did have a friend who was very goal oriented and she wanted to go to medical school, and she did get her volunteer work completed. But that was the biggest struggle for me undergrad, was just being able to have the time to do what I needed to do for post-grad work. And then the biggest challenge in PA school for me, during my didactic year, was figuring out again how to study and where to partition your time, and just creating a good balance so that you're still having time for yourself, and then maintaining good grades and things like that.
Thank you. It's great that you mentioned balance. That's our next question. How do you balance your time between family, academics, work, and just your personal life?
So I think that's one of the beauties of the PA profession is, like what Alexis was saying too, and the direct comparison that I think a lot of people make is MD versus PA, right? And we all know what the life of doctors is like. We're much more familiar with that kind of lifestyle and that training and medical school and residency and just how long it takes to actually become a doctor. I think what's awesome about PAs is that we can, while it's very hard and school is challenging and you have to learn, almost the same amount as in medical school, you are done in 2 to 3 years and you can start your career a lot earlier. So it's that part in and of itself is really great. You tend to be a little bit younger by the time you finish and start working. And I think what's really nice about the PA profession is while we do have a lot of responsibility and we know so much information and we function a lot of times as independent practitioners, we can talk about the logistics of having a supervising MD, but I have a lot of autonomy at my job. As Alexis was saying too, we do practice a lot of times independently. That is a really great thing, but it's nicely balanced by the fact that when I go home, I'm done. I'm not answering emails. I'm not answering pages. I'm not on call. Whereas I think the lifestyle of a doctor is a lot different. The doctors that I work with are never off. There's always something that they need to be responding to. And it's just a totally different thing. So I have been able to do a lot of traveling. My schedule allows me to, I'm an inpatient PA. So I work 3 to 4 12-hour shifts a week. And the days are really long, but then I have whole days off to myself. So no more grocery stores on Saturdays. That's a Monday project now. So there's a lot more flexibility, and it's really nice to kind of have that balance of working really hard for a few days and then time off to myself with no work, no pager, no emailing, just being able to really disconnect. So it's totally, I think, more doable to balance your lifestyle. I'm married. I have a house, very grateful that we as PAs make a good salary. I think that's a lot of things that people don't talk about, that we can we do well, which is great. It allows you to live a lifestyle that I feel like we can live comfortably. And I think what else is really nice is I don't have kids yet, but a lot of my coworkers do, and they're able to balance their families and work as well. So it's huge. I think that really plays a big role. And I just see the comparison of the doctors that I work with, and they have houses, they have families, they have lives, they do things, but there's always something else there. There's always that job that's there that they come back to. So I think the balance is really, really nice, where I feel totally satisfied with the work that I do, but then I can disconnect and still have a life outside of work. And I think that's really important.
Yeah, I would second everything that she just said. In PA school, in terms of in PA school, it's a struggle. You have to make time for the things that matter to you. And I talk to a lot of PA students now, and I always tell them, make time for you. I always said one night a week I was going out and I was going to have fun with my friends, or I was going to have a bottle of wine. I mean, whatever. You have one night a week to yourself. And I always made an effort to work out every single day. So those are things that I did for myself. It's much harder in PA school, but you have to put in the time for yourself there. In terms of my professional life now, same thing as Erica. I work inpatient in surgery. So I actually is a little different from her. I work either 3 12-hour shifts a week, or I work a 12-hour shift and a 24-hour shift. So I'm either going to work 2 or 3 times a week. And so the rest of that, obviously the 24, as you can imagine, is quite long. But other than that, I'm doing I have 2 other side jobs, pre-COVID. I, worked at a yoga studio and I dog walked, so you have a chance to do all these other things of experiences in life that I also enjoy outside of my career. This is a unique opportunity where I get to do that. And most of my friends, at least here in Boston, are also all PAs, and they work shift work as well. So I get to see them during the day on a Monday, or during the day on a Friday, or whatever. And we get to do things where most other people are working. So that's a really unique opportunity. In terms of the balance outside with having families or kids, same thing that Erica said, my personal opinion is that when I start having kids, I want to do a 9-to-5 job. So the beauty of being a PA is I can change my field at any given time and start going to an office and doing an office job. And I work 9 to 5. A lot of the people I work with love the fact that it's a 12 and 24-hour shift, and they don't really need to have daycare, so it gives you a lot of flexibility in your personal life, which I think is incredibly unique. Like Erica said, all of our attendings are on call almost all the time. Technically, there's only one attending on call per day, but everyone likes to take care of their own patients, which means they're almost on call all the time. So they don't really ever have the opportunity to go away for a week, or, when they leave the hospital, they're still worrying about their patient. When I leave the hospital, I do shift work. It falls onto the PA that came in after me, so that's a really nice work-life balance.
Regarding balance, speaking from like a student aspect, the first year I'd say was a little tough for me. Classes 8 to 5, and then sometimes you may be there till 7:30. But the professors will definitely let you know if that happens. But it took me a while to kind of figure out the schedule and things like that. I'd say it was pretty difficult. After I kind of figured out how PA school worked, talked to like my advisors and things who were readily available. One of them made the comment saying, hey, you used to be an athlete. Are you still exercising and things like that? And I had told her no, not at the time. And she was like, well, you used to do that every day, 24/7. I think you should try to like reintegrate that somehow. So I really made the time for me to exercise, and it helped me a lot, being able to de-stress and just like have that little bit of time for myself. But in the second year, things get a lot better. So being able to exercise like 3 times a week, make trips home and things like that, because I'm from out of state, was a lot easier to have like a better balance than first year. But first year is definitely very difficult, but not, you can get past it. You can do it.
All right, thank you. And we have another question. What has your experience been like working with a supervising doctor? Both good and bad.
They're not on the call, right? So I have a supervising physician who I love. He is wonderful. He's super supportive. And I really, really enjoy where I just actually worked with him this week. He was on service. So the way that it works on the inpatient side is, and I think it may be a little bit unique to what Dana-Farber does, is Dana-Farber is a cancer hospital, but they're mostly an outpatient clinic. So when patients who are Dana-Farber patients need to get admitted, they get admitted to Brigham and Women's Hospital. So I work in Brigham and Women's Hospital. And the oncologists who follow their patients, they kind of rotate through our service. So I'll have an attending physician that I'm on with, who's on service for a week or two at a time. And I'm with that person for, my 3 or 4 days for that week. So this week it happened to be my supervising MD, but it doesn't always happen that way. So that being said, my supervising physician, who I really, really love, I hardly get to see. So the fact that we're being supervised, it's not so much of what you think of as a supervising role. And I think it really depends on the job that you find, and it varies depending on where you are and what kind of, are you inpatient, outpatient, surgical? It really varies. We are with a physician every morning and we round on our patients, and then they have to leave and they go see their patients over at Dana-Farber Clinic. So the rest of the day, from probably like noon on until 7 p.m. when my shift ends, it's just us, the PAs. So we have a lot of responsibility. And our supervising physicians or whoever we're working with that day is always available by page or by phone. But the care of the patient at that time is up to us. So really love the supervising physician role. And I'm glad that we have it. Essentially, what logistically it means is that they sign off on our charts every few months, and they sign our notes at the end of the day, but they're not there at all times. I'm kind of watching over you. That's what I thought that it meant initially, but it really depends on what kind of role you're in. But only a positive experience in general.
So yeah, I would have to say almost the same thing as Erica just mentioned. It's definitely, I think, job specific. So I can only really speak to my profession. And Kirsten, this will definitely be applicable to you, is that when you're applying to jobs, definitely do not hide that you're a new grad. Because I, wanted to go to a job that was going to help me out and support wise. So at my hospital, our supervising MD is really our chief of surgery, who I never work with. He is barely in the hospital anymore and doesn't really do call ever. So I don't often see him at all. However, I work with 5 general surgeons, 2 vascular surgeons. There's a whole host of different other services of surgeons that I work with. So I work with them every day. I take care of their patients every day, but they're not technically my supervising physician on paper. So I definitely need a supervising physician for my license and for all of our licenses. And when you guys become PAs, same thing. But I never see him. I don't ever work with him. And rarely am I even taking care of patients of his, because he doesn't really even operate very much anymore. But in terms of the other surgeons, their support is incredible. I can always get them on the phone if I need to. However, I'm the only one in the hospital. They're barely even in the hospital unless they're operating. And when it comes to overnight, I'm the only one there. And, so it's a really unique opportunity where I have so much autonomy, which I love. And it was something I didn't shy away from as a new grad. However, not everyone's the same. Some people might want a little more oversight. Again, that will be to your own personal opinion when you are in that position. But like I said, I have tons of support. But at the end of the day, I'm really the only one in the hospital at certain times taking care of patients, which is awesome. And like Erica said, I thought that a supervising physician meant that we saw every patient together. That's definitely not true. I take care of all the patients myself. And if I have questions or I'm worried, then I always call them up and will ask them. But generally, I'm the one managing all of them on the floor. And when we operate, that's when I see all the surgeons. I stand across them at the table. But otherwise on the floor, it's just me. So it's a pretty unique role.
All right. Our next question. I know basically I think everyone mentioned taking a gap year. What was that like? What did you do at that time? And do you regret taking that time off?
I 100% do not regret taking that time off. I didn't take any time off in between high school and college, but I took off 3 years after undergrad before I went to PA school. And I said that that undergrad is really hard, and it totally is. That being said, I was still a type A pre-med genetics major kind of person, and I was like, okay, I need to graduate and I need to go right to PA school. Like, no wasting time. Like, let's go. I was very in that mode for most of college. And then when I graduated, I felt so tired and burnt out from school in general, that it was recommended by my advisor at the time, who I thank her every day, honestly. She was like, just take some time off. And that was like a really radical idea for me at the time. And so I did. I took a year to start. I found a job. Well, I should say I did some traveling first, because that's what I really wanted to do. So I spent some time in Honduras, and I was doing volunteer work. When I got back from that, I was there for a month or so not too long, but took some time to figure out where I wanted to go, and was traveling a bit in between there and seeing friends and family for the summer. And when I got back from Honduras, I found a job back up in Burlington, Vermont, which is where I went to school. And I just loved it really a lot there. And I knew I wanted to be back there for a bit. And then 1 year turned into 3 years, because I just loved living there. I loved working. I loved making some money, having a little bit of, independence and free time. And the job that I was doing there was in clinical research. So it was a really great experience. And that's where I met the PA who, kind of introduced me to the profession. So in that time where initially I kind of felt like, it was kind of a period of just kind of wandering and figuring out what I wanted, it turned out to be the period of time where I figured out what I actually really wanted to do. And where, I thank her all the time. I still see her every year at our annual PA conference. And I always remind her, I'm like, it's because of you that I'm so happy now in my job. So it was a great time to just sort of take some time, explore, travel, do things that you want to do, because you're going to be working for a long time, for many, many years. So it's a really great time to just take a break, but also get some experience and just, do something a little bit different. And I know it's really hard now, because I know PA school is really hard to get into. So I know there's a lot of focus on what can I do to make myself look like a better candidate. But that should be a well-rounded thing. You have to think about all different aspects, not just education and schooling and such. So there's a lot of different things that you can do.
Yeah, I totally agree. I didn't really know that I wanted to do PA school until about my senior year of college, because I was so focused on medical school. And when I was so focused that I'm going to go pre-med, I was like, well, I'm going straight through. I'm doing 4 years of college, 4 years of medical school, and then residency, and trying to bang this out. And then when I finally realized that I didn't want to be a doctor, I really wanted to be a PA, I had to take time off to do the required patient experience hours. And I was honestly really upset about it, because I was like, I'm going to be behind in my career. Everyone else is going to be, have gone straight from college. I'm also going to be like 27 when I graduate. I was just worried about it. And it happened to be the best experience of my entire life. I'm from the state of New York, and I went to college, obviously, in DC, I said before, but I always wanted to live in New York City. That was my dream. So I literally, the day after I graduated, I moved to New York City, and I got a job in a private practice ENT for office and plastic surgery. And I loved it. And it was a great experience. And I worked the grind, and I made $37,000 a year in New York City, and I paid $2,000 for rent. And it was awesome. It was the best experience of my whole life. And I did it for 2 years, and then I took off and I traveled for, like Erica said, I traveled for 2 months. I backpacked South America and had the time of my life. And I would never change anything about it. And I loved that the opportunity arose that I got to do that. So I highly recommend to any other prospective PA student that they should 100% take the time off, and they should live it up. I mean, I was only 22 in New York City. That chance only comes around once in a lifetime. So I definitely recommend it.
Yeah, I took 2 years off after college, and I got some of my coursework done at a local school back home. I'm from Maryland, or like Maryland, DC area. And the first 8 months of it was spent as a PT aide, because again, I thought I wanted to go to PT school. And then I had a surgery. So I had some time to think for a while on a couch, and I applied for new jobs because I thought I wanted to go, was in the process of thinking about PA school, and I wanted more direct patient care. So I applied to jobs and got one at a women's health office in DC, which was great. And I worked there for about a year and a half. I knew nothing about women's health, prenatal care, postpartum care, etc. And I really enjoy that specialty now. Again, I worked with a PA there, and seeing her do everything that she did, and her taking me down to Ecuador, and I also did a trip, mission trip in Honduras. So those 2 trips were amazing. And I don't know, just having the time to really focus in on what you wanted to do, have fun with friends and family, really allowed me to get some time in before I, took the leave and went to PA school.
Thank you. So our next few questions will be more logistics stuff about getting into PA school. So just basic, how many schools did you apply to? How many schools do you suggest applying to? And yeah, let's start off with that. We'll add on.
So I was thinking about this earlier and I can't remember. I think that I applied to 6 or 7, maybe more. I would probably err on the side of a little bit more because I was really nervous that I wasn't going to get in anywhere. So I just cast a wide net, and I really truly based it off of where I wanted to live and where I thought I wanted to maybe work in the future. So there wasn't any like great method that I used. It was just like, I know I want to live in I wanted to live in a city for a few years because I had been living in Vermont and I wanted to try something different. So I picked Boston. I looked a little bit in Manchester, New Hampshire, which is still not a huge city. And then I kind of focused my area there, my search there, and New York City as well. And I just got into the Boston schools and I chose to come here. And then I was also I was dating someone who is now my husband. So he factored into it as well. So nothing too profound in terms of like where I chose to apply to. I perhaps could have done a little bit more research, but I based it a lot off of location. I also knew that the Boston or New York City hospitals were obviously great systems, and that they had a lot of PAs in the area. So I thought it would be a good experience, but that's more hindsight. At the time, I was just kind of thinking about where I wanted to live, if I'm being honest.
Wow, sorry for you guys that Erica and I had the same experience about everything, but that's the same kind of story for me. That was also the same for me for undergrad. I picked based on location and I wanted to be in a city for undergrad. And that was the same for PA school. I wanted to be in a city. I wanted to be at a place that I could potentially see myself after PA school. And I wanted somewhere that had great medical systems. So I lived in New York City at the time. So I obviously applied to a bunch of New York City schools. And then I also applied to Boston and then other Northeastern schools that were within, 1.5 to 2 hours of Boston or New York, essentially. So I went to Northeastern actually as well. And I, kind of chose it because I loved it on the interview day. So I didn't go into the application process knowing I definitely wanted to go to somewhere. I picked on a location and then kind of judged the schools based on my experience with them at their interview day. So that's kind of how I ended up where I ended up.
Yeah, I'd say for me, it's the same as well. Location and proximity to home was big for me. I knew that I wanted to stay on the East Coast, though, somewhere there. The DC area, unfortunately, Maryland area doesn't have like too many schools, and they're ranked pretty high as well. So it didn't deter me from applying nonetheless. I mean, but we just don't have a lot of schools, so I needed to apply out of state. I also looked for like signs of diversity in their selection process for applicants. So being a student athlete, again, I did not have, I didn't complete all of the classes that I needed immediately. In undergrad, exam scores and GPA scores and things like that. I wanted to know that the university looks at or values other things outside of that. So once I found schools that did, then I applied there. But also the interview day kind of cinched it for me in terms of, what the professors were talking about. And, they let us view a class, which was awesome. So yeah, it was just kind of based on the interviews.
All right, thank you. This is more so for our current PAs. What do you think is the best approach to students asking you to shadow, or for shadowing hours?
Yeah, that's a tough one. I've been at my job for a while now. I've been there for 7 years. And twice a year, I used to host a pre-PA info session at Dana-Farber. And we would get a ton of people who would come to the session and then want to shadow, which was awesome. So we actually started a shadowing program at Dana-Farber Brigham and Women's where we could take in one person every week and match them up with a PA, and you could spend a morning with us. And it was awesome. And then COVID happened. So now we can't have any shadowers right now at Brigham or at Dana-Farber, unfortunately. So it's a bit on hold for the moment. COVID will, eventually be under control, and hopefully someday we can have shadowers back because I love having shadowers. I really miss it. And it's just unfortunate right now that we can't do that. I honestly don't know what other facilities are doing. I'm assuming that a lot of the big hospitals have similar policies where we're just trying to limit the number of people who are kind of coming in and out of patients' rooms. But it makes it really tough because I know you guys need hours now to even apply to PA school, I think. I know at least some of the ones in the Boston area you do. And I think that it's really been a little bit unfair for you guys. When I applied, you didn't have to shadow. Was it a totally valuable, wonderful experience? Absolutely. And I would recommend that you try to do it. I just think it's unfortunate that the hours are being required. But, the way that I did it pre-COVID times, I emailed a bunch of people. I actually shadowed my dad's cardiologist because I was like, that's a way to kind of get in. I totally am welcome to receiving emails from folks asking about shadowing, and we kind of keep a running list of who still wants to. So you guys are totally feel free to shoot me an email if Cheeseman wants to distribute that afterwards. Totally fine with me. We just can't accommodate people right now, but someday, I know that might not help you guys at the moment, but we'll get back to it eventually.
Yeah, so we actually had a meeting today. We are actually now allowing shadowers and students at our hospital. It's a little bit farther outside the city, however, so if you don't have a car or anything, it's going to be a little more difficult for you. But I'll give Cheesna my information, obviously, to distribute to anybody, and anyone's welcome to ask if they're at all interested in surgery. But like Erica said, I think you should send out emails. That's how I did it. Professional emails to anyone you can find. Worst is that no one emails you back. I mean, there's nothing bad that can happen from sending out a good email. Also, from my perspective, I didn't shadow anyone before PA school. I really just worked, and I took that gap year for 2 years, and I worked for that time. And that's where my hours really came from. So I didn't really do much shadowing. Also, luckily in my undergrad, it gave me the experience to work in the ER. So that's really how I found out about being a PA and like what it means to be a PA. If you don't have that opportunity, I think shadowing is really important because how else are you going to know what a PA really does? So like I said, send out a mass emails to anybody that you can.
All right, so we're right up at 6:20. We have about 10 minutes left. I want to open it up to anyone who has their own personal questions. If not, I have a few more I can ask from the list of questions I have. So if anyone wants to ask, go ahead.
I have a question. What did you guys do for your patient care hours? Like before applying to PA school?
Yeah, that's a great question. So when the 3 years that I took off after undergrad, I worked in clinical research. So it's called a CRC, a clinical research coordinator. And I worked in oncology, and I had direct patient care hours, consenting patients for protocols. Well, I should say this, some schools count that as direct patient care hours, being a CRC. Some schools don't, so you have to really look at the prerequisites and the requirements for the schools that you're applying to. And so I worked for 3 years, so I had a lot of hours from doing that. I was worried though that the just protocol consenting and talking to patients about research studies wasn't, considered hands-on care. So I actually became a phlebotomist, and I used to draw blood for the research study patients. And so I put in a lot of hours doing that too. So that's how I got my hours. But I would encourage you to check in with the schools, see exactly what they would count. Great ways to get hours are being a PCA, nursing assistant, PT assistant. You can get EMT certified. I know that takes, a bit more effort and more time. But there are a lot of different things you can do.
Yeah, so I worked as a medical assistant at an ENT and facial plastics office. I also didn't hide the fact that I wanted to go to PA school, and I was very, present with that fact with the other doctors that I work with, and let me do a lot more because they, were like, you're driven, you really want to do this. Let me give you opportunities. So I was lucky to work at a great private practice that really helped me get a good experience. But, at the end of the day, yeah, I just worked as a medical assistant. So I was just bringing patients into a room, and that's really it. But it counted. And, it was honestly a great experience. So I think, but when I was looking for patient care experiences in my gap time, I applied to everything, like being a phlebotomist, anything you can think of, being a PCA, patient care assistant, essentially, everything. I did everything that I could. So I think that you should just have no expectations, and don't have any real, I definitely want to do this one thing. And it might be a better route to go with that. But yeah, I think just try anything you can that has to do with patients. If you look at a list, a lot of the PA schools will post on their website of what they count for patient care hours. And it's pretty extensive of what they'll count. So you just look at that and apply to anything within that field, is what I did essentially, and landed with something.
Yeah, I was a PTA for the first 8 months, and then became a medical assistant at a OBGYN's office in DC, and that experience was great. Again, they, just like Alexis had mentioned, they let me do a lot once they knew, that I wanted to go to PA school, and a lot of the other medical assistants also wanted to go to some sort of medical school or MP school, something like that. But yeah, the practitioners there really got their medical assistants involved in a lot of the patient care. We consulted with patients. We even had our own little walk-in room where we saw pretty simple things, and then we'll go report to the practitioners there. So I'd say that it really opened my eyes to the medical profession. It was a pretty good job.
Also, if you don't feel comfortable speaking, you can just send it in the chat and I'll ask. There was one question I had in the chat earlier. It was about liability, knowing that you're working with the doctors. Are there any issues with liability? How do you handle that?
In terms of just feeling the kind of pressure of the responsibility, is that kind of what the question was directed to, you think?
Yeah, I think it might. Jyoti, go ahead.
So my question was basically, I was thinking, I don't really have anyone in my family who has medical connections. So I wanted to know as much as possible. And I was looking at things, and there was malpractice insurance and all that stuff. And just my reading, that sounds scary. So I just wanted to know how different it was for PAs compared to MDs. For patient, how do you take care of patients knowing that there's something like that in place?
Yeah. Thank you for clarifying that. It's a good question. Our hospital, at least Dana-Farber and Brigham and Women's, we have liability insurance. So we sign a contract and insurance is kind of covered as being part of the hospital. So when you're applying for a job someday, it's a really good question to ask, like, what is my liability insurance? That's just the logistical piece of things. It's not something that you have to like purchase on your own. If you go into private practice, I'm sure perhaps that there's a little bit more detail that you need to think about. But in the hospital system, at least, it's something very simple, and I feel very secure with the plan that we have there. In terms of the kind of deeper meaning of what that means, you have people's lives in your hands a lot of times, and you do have a lot of responsibility. And I don't think that should scare you. I think it's a wonderful opportunity. I think the first year or so that I worked in my job, I'm the first person who gets pages for rapid responses, we call them. So like a patient who's not doing well, who's getting acutely ill. For the first year of my job, I was like, they're calling me, like, are you sure? And it just takes a long time. It takes not a long time, but it takes some time to feel like you are, going to be a well-rounded and capable clinician. But that's why you go to school, and that's why PA school is hard. But you come out with the ability to take care of patients, and that's a huge privilege, and it is a huge responsibility. But this is why there is this program, why PA school is challenging, and why there's really wonderful people like you guys who are going into it. You all have the ability. You just have to apply yourself during school and work hard, and you'll get there. It's scary, and it feels sometimes like, wow, like this is a lot that I'm taking on here. But knowing your resources and knowing that there is a doctor that I can call when I need help, like that is one of the reasons why I wanted to be a PA, to have that collaborative work. So while we say that we are independent and we have a lot of responsibility, there's a huge network of people who help. I work with a bunch of other PAs who I can call if I need help. So there's a big network, and you never feel like you're alone. So even though there is a lot of responsibility and thus liability, it's a really great field to be in. And the colleagues, like your PA colleagues, are the best.
Yeah, I'll say the same. For my hospital, we were given liability insurance when I signed my contract to start working there. And from most of the people I talk to, it's the same with them as well. You'll be provided with the insurance when you start working. With that said, I totally agree with what Erica said. You shouldn't be, you should be afraid in terms of like she said, these are people's lives. They are in your hands. You're going to be giving patients advice on what you think, is going to be the best course of treatment that they should, go down. But like she said, an awesome privilege. It's really incredible to be able to develop these skills and apply them to another human being. And, I know when I first started working, this is coming up to my year that I've been a professional PA at this time. And it's taken me almost a year to actually feel really comfortable in my job. Not totally comfortable yet, but really comfortable. And I remember when I first started working and a patient asked my opinion, and I was like, I don't think I'm allowed to have an opinion. Let me ask somebody. But, you will be able to get to that point where you're going to have the opinion, and that's your job. So it's a pretty incredible thing to be a part of, and it should not be taken lightly by any means. But like I said, you're going to be trained for this. And another thing that I loved about medicine is that you will be learning for your whole career. I love learning. I loved school. I loved college. I loved everything about learning. And that's why I love medicine. Like, it's constantly changing. You're constantly learning again. So don't ever think you're done by any means. So, that's another thing that I think is important to remember as well.
Thank you. So we are all right at 6:30 p.m. Did anyone get a photo? If not, it's taking one at the end. Okay. Oh, Kirsten, let's take the picture. Is everyone okay with taking the picture right now? And again, if not, you can just turn your cameras off. And if you don't want your name on there, just let me know and I'll let her know to block it out.
Well, thank you guys. One of my professors, when I asked them about this, just asked me to take a photo. So
Which one?
werent.
Yeah, I'm not surprised.
Okay.
Right, so whenever you're ready, go for it.
Let me see if I can. Okay. I don't even know if there's like a screenshot function, but I can like print screen.
If you search on and just type screenshot,
Yeah.
it'll show up.
Oh, if I type it.
It's
Actually, I can do it.
Okay.
All right.
Thank you.
I'll let you know when I'm going to release it so we can all get ready. All right. Ready? 1, 2, 3. I'm about to let it go. We'll take another one just in case. 1, 2, 3. We're going. All right. We got it.
Thank you.
You're welcome. And I'll send that to you. Well, thank you everyone for coming. And thank you, Erica, Kirsten, and Alexis for sharing your experiences with us. We really appreciate it. I know I do. I was completely lost freshman year and I'm still a little lost every now and then. So this really helped me. And I hope it was helpful for everyone else too. And I'll share your information with everyone if that's okay. I'll get that later on and I'll make sure to send it. If I missed your email for some reason, please let me know and I'll forward that to you. Thank you. And
Nice
I'll
meeting everybody.
Questions.
Thank you.
Thank you so much.
Thanks.
Bye-bye.
Bye.
Thank you. Bye.
Bye. Thank you.